I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get pregnant. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
I'm Dr. Kara Willenberg, a physician and chief of infectious diseases at Marshall Health. You might be wondering, how do COVID mRNA vaccines such as the Pfizer and Moderna vaccines work? First, let's start with the ingredients. The mRNA vaccines are made of sugars, salts, lipids, and mRNA. The mRNA, or messenger RNA, tells our body how to make proteins. The COVID-19 mRNA vaccines teach our cells how to make copies of a spike protein that resembles the spike on the outside of the virus. Once our bodies create that spike protein, our immune systems are able to make antibodies. Antibodies can then recognize the virus if we come into contact with it and fight it off. The mRNA from the vaccine does not enter our cells where DNA is made, so it cannot affect our DNA. The mRNA breaks down and goes away quickly, leaving in its place the blueprint for protection. The COVID-19 vaccines boost our natural defenses against the virus. It takes our bodies about 2 weeks after the second dose of the mRNA vaccine to develop maximum protection. You cannot get COVID-19 from the vaccination. By choosing to get vaccinated, you are teaching your body how to defend itself from COVID-19. Vaccination is the safest path toward building a community of immunity. Thanks for tuning in. I'm Dr. Kara Willenberg, and I recommend COVID-19 vaccination to my patients, my family, and my friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Gilbert Goliath. I'm a pediatrician in Charleston, West Virginia. I've been practicing medicine for over 30 years. The parents and caregivers of my patients often ask if children and adolescents should get vaccinated against COVID-19. My answer is yes. As of June 2021, COVID-19 vaccines are available for individuals 12 years and older, and I recommend COVID-19 vaccination to my patients who are able to receive it. As a pediatrician, I've seen cases of COVID-19 among my patients. Although many cases of COVID-19 among children are mild, some cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And as we learn more about COVID-19, we're finding that even mild cases in children can lead to long-term health problems. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the vaccinated individual, but those around them as well, especially children under 12 who cannot get the vaccine yet. I recommend that my patients aged 12 and older get vaccinated, and I suggest that all parents and guardians discuss COVID-19 vaccination with a healthcare provider. Thank you for tuning in. I'm grateful for your time in discussing this important matter. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hi, I'm Mrna Ellis, a nurse practitioner in West Virginia. I've had the pleasure of serving Southern West Virginia in healthcare for the past 10 years. Patients sometimes ask me if they should get the COVID-19 vaccine if they've already had COVID-19. My answer is yes, you should get the vaccine, even if you've already had COVID-19 and recovered. Although people develop some amount of immunity from getting infected with the virus that causes COVID-19, it is not known how long you'll be protected from getting sick again. Even if you have already recovered from COVID-19, it is possible that you could be infected with the virus or one of its variants again. COVID-19 can cause severe illness or death, and we can't predict who will have mild or severe cases. Some people continue to have long-term health issues from COVID-19, even with mild cases. You can also spread the virus to others, including your family, even if you don't have symptoms. Vaccination is the safest path toward building a community of immunity, even if you've already had COVID-19. Thanks for tuning in. I'm Mrna Ellis, and I recommend the COVID-19 vaccination to my patients, family, and friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Allison Lastinger. I am a physician specializing in infectious diseases and medical ethics at West Virginia University. I've taken care of many patients with COVID-19 infection. Sometimes people ask me if the benefits of COVID-19 vaccination outweigh any risks of the vaccine. This is the primary question that leading public health and medical experts thoroughly examine as they consider authorizing and using new vaccines. In fact, the FDA only authorizes or approves vaccines that have undergone intensive clinical trials and were found to be safe and effective. This is certainly true for the COVID-19 vaccines, where the benefits such as significant protection against severe disease and death far outweigh the risks of vaccination, which can include minimal short-term side effects and serious but very rare side effects for a small number of people. The risks of vaccination are smaller than the risk of COVID-19 infection itself. The vaccines have proven themselves to be highly effective in preventing severe illness, hospitalization, and death from COVID-19. They are also demonstrating effectiveness against new variants. The COVID-19 vaccines play an important role in protecting you and those around you, including our most vulnerable and those who cannot yet be vaccinated, such as young children. Because there are substantial benefits of the COVID-19 vaccination, I got vaccinated and recommend COVID-19 vaccination to my patients. Thanks for tuning in. I'm Dr. Allison Lastinger. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Rebecca Reese. I'm a physician and infectious disease expert in West Virginia. Throughout the pandemic, I have cared for many patients with COVID-19 and have led research on COVID-19. We are hearing a lot about COVID-19 variants, and naturally there are questions about what they are and if the vaccines are effective at protecting against them. Viruses constantly change through mutation, creating new variants or strains over time. Sometimes new variants emerge and disappear, other times new variants emerge and stay. Multiple variants of the virus that causes COVID-19 have been found in the United States and around the world during this pandemic. These variants are slightly different from the past strains, and they can even infect people who had COVID-19 before. Scientists continue to study these variants. For example, they are looking to see how easily they spread, the severity of the disease they cause, and how well the vaccines work against them. Ongoing studies have found that the COVID-19 vaccines can help prevent severe disease, hospitalization, and death from the variants. Areas with low vaccination rates are more vulnerable to the virus transforming, potentially becoming more contagious and severe. Large portions of our communities getting vaccinated helps create a firewall against the virus, preventing the virus from spreading and changing. The faster we get vaccinated, the faster we can build a community of immunity against the virus and its variants. Protecting our community from variants is one of the reasons that I chose to get the COVID-19 vaccine and why I recommend it to others. Thanks for tuning in. I'm Dr. Rebecca Reese. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hello, everyone. It's Thursday, October the 7th. We've been going round and round lots of different stuff. I think Bob Ashley is retiring, and well, I know he is, and Bob we're going to bring back on a contract basis, and he's going to do work from time to time, but he's served his state very, very well in my office, and you know, we wish Bob the very, very, very best in every way, and I want to make sure that we mention that right off the get-go. The other thing is just this, did we not discuss many times, we said really and truly, getting yourself vaccinated won't stop the surge that we're in. It won't do it, and we know that. You know, since the last day we were here on Monday, we have lost 97 more West Virginians, 97 of them. Now, with all that, you'll see that our numbers are getting better, which leads us to absolutely believe wholeheartedly that we have passed through the eye of the storm. But in getting to where we were at the peak, many of these folks were hospitalized, and we lost a lot of them. We're going to continue to lose some more and more, but absolutely please keep them in your prayers. Today we got lots and lots of stuff to go over, and it's going to take a little while today. It's especially going to take a little while for me to sit here and read 97 deaths to you. But absolutely, out of respect for all these people, I will absolutely do exactly that. And I'll offer up my prayers and Kathy's prayers and ask for all your prayers for all these great West Virginians that we've lost. We're heading right towards 4,000 deaths in West Virginia. And who knows exactly where it'll stop. But with all that and everything, we continue to pray, and we continue to know that God above will get us through this. We absolutely see our numbers getting better, but we've still got to be on our game and be on guard. The 3,770th death in West Virginia is a 75-year-old male from Pocahontas County. The 3,771st death, a 79-year-old female from Raleigh County. The 3,772nd death, a 52-year-old female from Cabell County. The 3,773rd death, a 74-year-old female from Berkeley County. The 3,774th death, a 94-year-old male from Cabell County. The 3,775th death, a 44-year-old male from Marion County. The 3,776th death, a 76-year-old female from Hardy County. The 3,777th death, a 65-year-old male from Berkeley County. The 3,778th death, a 57-year-old male from Fayette County. The 3,779th death, a 78-year-old female from Morgan County. The 3,780th death, a 71-year-old male from Wyoming County. The 3,781st death, an 81-year-old male from Cabell County. The 3,782nd death, a 65-year-old male from Marion County. The 3,783rd death, a 55-year-old male from Wood County. The 3,784th death, a 63-year-old female from Hancock County. The 3,785th death, an 81-year-old male from Marion County. The 3,786th death, a 63-year-old male from Marion County. The 3,787th death, a 57-year-old male from Hampshire County. The 3,788th death, a 90-year-old female from Marshall County. The 3,789th death, a 66-year-old male from Marion County. The 3,790th death, a 64-year-old male from Harrison County. The 3,791st death is a 69-year-old female from Cabell County. The 3,792nd death is a 62-year-old male from Summers County. The 3,793rd death, a 41-year-old male from Mercer County. The 3,794th death, a 64-year-old male from Mercer County. The 3,795th death, a 58-year-old female from Raleigh County. The 3,796th death, a 60-year-old female from Cabell County. The 3,797th death, an 87-year-old female from Marshall County. The 3,798th death, a 67-year-old male from Lincoln County. The 3,799th death, a 68-year-old female from Nicholas County. The 3,800th death in West Virginia, a 73-year-old female from Wood County. The 3,801st death, a 64-year-old female from Lincoln County. The 3,802nd death, a 74-year-old female from Raleigh County. The 3,803rd death is a 73-year-old male from Marshall County. The 3,804th death is a 66-year-old male from McDowell County. The 3,805th death is a 72-year-old male from Marion County. The 3,806th death is an 81-year-old male from Fayette County. The 3,807th death is a 69-year-old male from Boone County. The 3,808th death is a 71-year-old female from Cabell County. The 3,809th death is a 76-year-old female from Raleigh County. The 3,810th death is an 80-year-old male from Preston County. The 3,811th death is a 67-year-old female from Harrison County. The 3,812th death is a 72-year-old male from Hancock County. The 3,813th death is a 78-year-old female from Wood County. The 3,814th death is a 51-year-old female from Raleigh County. The 3,815th death is a 64-year-old female from Cabell County. The 3,816th death is a 71-year-old male from Fayette County. The 3,817th death is a 56-year-old male from Cabell County. The 3,818th death is a 78-year-old male from Kanawha County. The 3,819th death is a 56-year-old male from Fayette County. The 3,820th death is a 60-year-old female from Barber County. The 3,821st death is a 46-year-old male from Wood County. The 3,822nd death is an 81-year-old male from Hampshire County. The 3,823rd death is a 73-year-old female from Grant County. The 3,824th death is a 70-year-old female from Morgan County. The 3,825th death is a 51-year-old male from Marion County. The 3,826th death is a 59-year-old female from Berkeley County. The 3,827th death, a 44-year-old female from Marion County. The 3,828th death, a 46-year-old female from Preston County. The 3,829th death, a 64-year-old male from Hampshire County. The 3,830th death is an 81-year-old male from Jefferson County. The 3,831st death is a 76-year-old female from Wood County. The 3,832nd death is an 83-year-old male from Wood County. The 3,833rd death is a 96-year-old female, the 3,833rd death is a 96-year-old male from Raleigh County. The 3,834th death is a 73-year-old male from Lewis County. The 3,835th death is an 83-year-old female from Wayne County. The 3,836th death is a 68-year-old male from Wayne County. The 3,837th death is a 67-year-old male from Wood County. The 3,838th death is a 69-year-old female from Wood County. The 3,839th death is a 70-year-old female from Monongahela County. The 3,840th death is an 80-year-old male from Mercer County. The 3,841st death is a 76-year-old female from Wood County. The 3,842nd death is a 73-year-old female from Raleigh County. The 3,843rd death is a 67-year-old female from Hancock County. The 3,844th death is a 62-year-old male from Taylor County. The 3,845th death is a 65-year-old male from Preston County. The 3,846th death is a 75-year-old male from Nicholas County. The 3,847th death, a 37-year-old female from Mercer County. The 3,848th death, a 75-year-old female from Raleigh County. The 3,849th death, a 63-year-old female from Preston County. The 3,850th death, a 68-year-old female from Ohio County. The 3,851st death, a 75-year-old male from Morgan County. The 3,852nd death is a 70-year-old male from McDowell County. The 3,853rd death is a 44-year-old female from Summers County. The 3,854th death is a 91-year-old male from Hancock County. The 3,855th death is a 73-year-old female from Mercer County. The 3,856th death is a 65-year-old female from Lewis County. The 3,857th death is a 72-year-old male from Raleigh County. The 3,858th death is a 49-year-old female from Nicholas County. The 3,859th death is a 39-year-old male from Monongahela County. The 3,860th death is a 77-year-old male from Wood County. The 3,861st death is an 88-year-old male from Kanawha County. The 3,862nd death is a 90-year-old male from Raleigh County. The 3,863rd death is a 72-year-old male from McDowell County. The 3,864th death, a 94-year-old female from Kanawha County. The 3,865th death is a 93-year-old female from Randolph County. The 3,866th death in West Virginia is an 83-year-old male from Mercer County. That's the most we've ever had to read. It's awful. It's really, really sad. We're going to get through this, West Virginia, but please keep these folks in your prayers. Call them. Don't let them feel alone. Please don't let them feel alone. Now the news, this is the impact of the surge at its peak. We're going to have more people die. But our active cases are down to 11,629 right now. Our new positive level is at 1,525 with a daily positivity rate of 8.67. Our cumulative is just barely under 6% at 5.97. We do have 233,836 people that have recovered from this dreaded disease. We're down now. We were at a peak of 1,012 people that were hospitalized, and we're down to 892. We were at a peak in the ICU units of 296, and now we got 260. We were at a peak of the people on ventilators of 195, and now we're at 179. It's dropping, but it's not just falling off a cliff. It is dropping. But we want these numbers down, and down as quickly as we possibly can. We got 2 green counties. We do have our numbers in our schools better. We're down to 60 school outbreaks in 24 counties. 697 kids have got this. All but 54 of our counties have a mask mandate. This is really important. And I have no clue why in the world or where President Biden and his group are going on this. But people have an absolute right to voice their opinions. We get to the point in time where we don't believe that parents should have some level of control and input, if not all, on what our kids are being taught in school. Where in the world are we going with this? Where on earth are we going with this? From the standpoint of calling people that are concerned about their children and coming out and voicing an opinion and calling them domestic terrorists? Are you kidding me? I just can't fathom it. I can't fathom it. From the standpoint of our hospitals, like I said before, we're still teetering on about 20% of the folks that are in our hospitals have been fully vaccinated. That's all tied back to our booster shots. We know that when we got out of the gate really fast, and we know we've got people that are fully vaccinated and really maybe have not taken advantage of the booster shots and everything. The booster shots are leading the way, but you've got to get your booster shot. 18 and above, go get your booster shot. It'll cut down on those that are hospitalized, I promise you. A reminder again about all those 65 and above, if you feel any symptom whatsoever, please just go get a test. If we catch this early, these antibodies will keep you out of the hospital. They'll absolutely save your life. I encourage everybody about wearing a mask. If you're indoors and you're compromised and you're 65 and above, or maybe 50 and above, and you're around a big crowd of people, you're indoors, you've got diabetes or lung issues or whatever it may be, think really hard about wearing a mask. It will help. It is not the end-all, do-all, but it will help. From the standpoint of what I've said over and over about our booster shots, they're available. They're absolutely available to all folks above the age of 18. Absolutely. If you're 6 months out from your last shot and you're Pfizer, you had the Pfizer vaccine, go get your booster shot. That Pfizer vaccine, 6 months out, has dropped off on the preventative level from probably 95 to 30 or 95 to 20. You need your booster shot. If you've lost your card, call us, get in touch with DHHR, they'll get you another card. Now, there's some really good news here, in that, I can tell you without any question, we're ready to get those shots in arms and everything. The faster you come, the faster we'll get shots in people's arms. And as we led the nation in getting the vaccines out and getting them out, and in the arms of our people and saved who knows how many lives, surely a boat full of lives and everything. Our goal is to lead the nation, and we're on the way right now to leading the nation with our nursing homes and our elderly and getting the boosters out. Now, I've got some really, really important, not to overshadow this in any way, but we do have to do the business of government. We do have to continue on, do we not? Today, I am announcing a Senate appointment to a gentleman that I know, and I know fairly well and everything, and I know this man will do incredible work. A great African American. Today, I am announcing the appointment of Owens Brown to the West Virginia Senate 1st District, which covers Hancock, Brooke, Ohio, and parts of Marshall counties. Mr. Brown is from Wheeling and is the West Virginia State NAACP president. Now, let me tell you just a little bit about Mr. Brown. He is now going to be the first African American serving in our Senate in over 20 years. And not only that, he is the first male African American in our Senate ever. And I congratulate him beyond belief. He will do an incredible job. I know he will. I am so, so proud of this and everything, because we need diversity. We need other opinions and everything. Absolutely. I know without question that Owens Brown, I congratulate you, and I am so proud to do that. So it's a really, really good day. Now, the other thing about good news is just this. The West Virginia, this is a giant announcement in my opinion, but it just echoes what I've said over and over about West Virginia and moving forward and moving through this terrible pandemic and just flat killing it. And what I mean by that is economically, West Virginia has absolutely continued to do it. We've led the way. We have absolutely pushed the right buttons. And so today I'm announcing that West Virginia now ranks, now get this, among the top 10 states in the entire nation for GDP growth for the second quarter of 2021. The U.S. Bureau of Economic Analysis just released this data, and West Virginia's GDP growth grew at 7.3% during this quarter. Now, this is significantly more growth than all of our bordering states. It's amazing. It's just amazing. Businesses are scaling up operations. We're knocking it out of the park all across the board. We can always do more, and we'll flip every stone until we absolutely are able to touch all. We're going to continue to do just that. We've seen big gains through tourism and hospitality and mining and the oil and gas sectors. West Virginia, I've said it, I don't know how many times I've said just this. You know, close your eyes and think about a place that had 4 of the most beautiful seasons on the planet, a place that is within a rock's throw of 2/3 of the population of the country, a place that abounds in the greatest people, that's our real resource, and a place that abounds in our natural resources like you can't imagine. And it's just not coal and oil and gas, it's water, timber, and on and on. And imagine that place to where the world is starting to really realize just how good we really are. The diamond in the rough that they missed. Imagine that could be West Virginia. And it truly is. And that in itself, we have told our story. We have changed our image. And West Virginia is absolutely killing it. And that is so, so, so good. I thank so many, and I'm going to miss a bunch of people. I thank the legislature for all they've done to eliminate red tape and everything, and reform the tax code, and make West Virginia a business-friendly state. I thank all the people that have made and pushed the right buttons from our revenue department and led by Dave Hardy and all those in the governor's office that have come to me and helped us make the right decisions. At the end of the day, and I've said it all along, I truly believe God above put me in this position for a reason. I've done a lot of stuff in my life. I've had to handle tough stuff, really tough stuff. This pandemic is just absolutely something else that we had to handle. It's tough, really hard. The business side of keeping the state prosperous and moving forward, tough stuff. But that's exactly why I think I'm here. Now, at the end of the day, and I want to read just this stuff to you because they gave me this in just notes, but they said, now step back and think about what has been accomplished in the last little while. Over the past 18 months, we've had to navigate through this terrible crisis like we've had, something we've never dealt with ever before. But in doing so, we finished the last fiscal year last year with a $413 million surplus, despite all the stuff that was happening. $413 million. I mean, for crying out loud, do you realize what West Virginia's either deficits or surpluses were in the past and everything? This is a gigantic number. And so far this year, right now, we have a $142 million surplus right now in the first 3 months of the year. Our unemployment rate has decreased 16 straight months, and now we rank in the top 10 in the GDP growth in the nation. It's amazing, amazing. A lot of people put in a lot of great licks, and I absolutely thank each and every one of them. The outside world's walking around thinking West Virginians that diamond in the rough that they've missed. We've invested big time in tourism. And absolutely, we still, even though it has grown phenomenally, Chelsea Ruby has been a secretary that has done fabulous work. But in that, I am telling you just as well as I know my name, that we still have major, major growth in tourism that's right at our fingertips. All we need to do is just keep telling our story. We want to be the number one in GDP growth in the third quarter. All I would say is just keep pouring it on, West Virginia. Keep doing the great stuff you're doing, and let's keep moving forward. Now, I'm not going to spend a whole lot of time on this, but a negative thing that I think we need to talk about just happened yesterday. But yesterday I was made aware through media reports that Charleston Mayor Amy Goodwin had sent a letter to myself, the Senate President Craig Blair, and the House Speaker Roger Hanshaw. And she wants us to call a special session to discuss several ideas that she's come up with to address substance abuse, homelessness, and the mental health issue in West Virginia. And it sounds just great, doesn't it? It sounds just absolutely wonderful that the mayor of Charleston is doing such a marvelous job that she just comes up with these marvelous and ideas. Now, make no mistake, what's this really all about? It's nothing except a political move to cover up her deficiencies. And if we'll just stop and sit back and think about this. According to the National Alliance to End Homelessness in West Virginia, and we all want to do better, West Virginia's overall homelessness rate is decreasing. Except, just maybe, except in her hometown. In her town she's supposed to be running. I mean, for God's sakes alive, if Amy Goodwin wants to do something, why doesn't she do something in Charleston? Why are we having to walk down the streets and see tragedy all over the place with people, homeless people, sitting on the sidewalks and whatever, all over the place, needles everywhere, even in our playgrounds? I mean, why should we be doing that? Why in the world should we be doing that? And then the mayor of that city that's got $57 million of CARES money, what on God's earth is she spending the money on? What's she spending the money on? Now, just think. Let's just be real. You know, what I want to read this last little bit to you and just tell you just this. Despite the problems that we see in Charleston every day, half of Mayor Goodwin's solutions are to replicate the Charleston model all across the state. Well, why on God's earth do we want to do that? Do we want to replicate Charleston all across the state of West Virginia? Are you kidding me? Are you totally kidding me? I mean, for God's sakes alive, this would be like me saying, you know, like even the homeless people are out in front of my house right here at the mansion. I mean, they're right dead out in front of the mansion, you know. I mean, are you kidding me that we want that all across West Virginia? I'd say, Amy, my God alive, you know, there's an old saying, you know, those who live in glass houses ought not to be casting stones. I mean, you think about that for a second. I mean, literally, you know, if you could just see the mess that's going on right here, and to think that somebody would go out with some political move and absolutely go out and absolutely try to bash all across West Virginia for the grandstanding to get her name in the paper. Do it, Amy. Good job. Good job. Now, you know, I personally believe that the vast majority of West Virginians do not want their towns to start handling their homelessness like Charleston does. And they said, you know, and she also said that, you know, that our elected officials across the state should decide. And so I just tell you just this, Amy, baby, listen, if you can get the legislature to go along with a special session to discuss these bills, I'll absolutely do it. I'll absolutely do it. If you get the legislature to go along with this, I'm all in. But if she really wants to fix things, the first thing she ought to do is call a special session of her own city council to clean up West Virginia. You know, I'm sitting on almost 60 million that she has, rather. She's sitting, I just said it just a second ago, $57 million that she's sitting on. Why in the world doesn't she clean up her own town? If she's sitting on $60 million, why in the world doesn't she clean up her own house? Okay, you know, I think I'm going to defer here to Secretary Crouch. You know, he's going to come on just a second and he's going to talk about saving our care, which is, you know, doing good stuff for our hospitals. And I think we've got some other people that are going to talk. And then I've got more stuff I got to tell you. So just hang in there. You know, we're going to get through all of it. You got him, Jordan?
Yeah, Secretary Crouch, we'll turn it over to you now.
Good morning, everyone. Thank you, Jordan. Thank you, Governor. I promised an update on the Save Our Care initiative that the governor started and is pushing hard to get us to develop and finalize. We had a meeting I mentioned with the hospital folks last week and sorted out in the hospital association and sorted out a methodology. We received all of the information that we needed just yesterday from all of the hospitals to be able to make these decisions. So to eliminate overlap of other funding, DHHR will provide support covering some of the hospital's additional cost and staff hired through staffing agencies, overtime for existing staff, and some of the retention efforts that hospitals have entered into to try to keep the staff that they have. We're looking specifically at staffing costs related to the current surge so that our funding does not overlap with other funding, federal funding that hospitals receive. We're working closely with the association and some of the hospitals directly with regard to their financial condition. I want to thank all of the hospitals who've struggled throughout this pandemic and the hospital staff who have consistently, as the governor says, ran to the fire for 583 days now. So thank you all. We have three distinguished guests today. They represent three of the three largest hospital systems in the state of West Virginia. So I'd like to introduce, first of all, Albert Wright, who's President and CEO of West Virginia University Hospital Systems, and ask Albert to say. Albert?
Thank you, Secretary Crouch. Appreciate the opportunity today. You know, this current surge has been the most challenging thing I've ever seen in my 25-year career of doing this. You know, just the number of COVID patients and hospitalizations that we've had. But on top of that, it's just the staffing challenges, and staff have been pulled all over the country and are traveling and trying to help out in other areas, and it's been a real challenge for us. So we appreciate you know, your efforts, Secretary Crouch, and especially the efforts of Governor Justice to recognize the challenges we're facing in this current surge and to help with some resources and funding, which will allow us to bring in some travel staff, will allow us to pay some overtime, and will allow us, quite honestly, to bonus some of our folks that we need to retain. So we'll do some retention bonuses and get through this. It's encouraging to see the numbers coming down. The cases in the state will come down a little bit quicker than hospitalizations, but I'm, you know, happy to see those coming down. And you know, if you know loved ones that work in our hospitals, please say thank you to them, because they're working hard. And I know we're very proud of our folks, you know, and at this point in our healthcare system, I'm proud to say we're looking at the numbers this morning, and our employees are about 90% vaccinated. So they're listening to the governor's message and the staff members of the governor and going out and getting those vaccinations. So I think that's encouraging and much appreciated. And I just have to applaud Governor Justice and his team of advisors for the great job they've done in leading the state through the COVID pandemic. The governor, along with yourself, Secretary Crouch, have been great partners when we've needed resources from the early days around, you know, personal protective equipment and booster shot or original shots. And now a lot of folks are getting boosters. You know, I speak on behalf of all of our employees and lots of hospitals around the state that we're very pleased and thankful for the governor's leadership.
Thank you, Albert. We appreciate that very much. And let me mention that we're at the GIATF today, so we're having a little inconsistencies here in terms of our signal coming in. So Clay and Jim and I are up here, and I apologize if it's just broken up a little bit in terms of the voice on this. So let me introduce Dave Ramsey. Dave is President and CEO of Charleston Area Medical Center. So Dave.
Thank you, Secretary Crouch. I want to just extend a thank you to the governor. What you're doing today with Save Our Care is, you know, very meaningful to CMC and really hospitals across the state. The recognition of how important hospitals are to the fight against COVID and the challenges we face caring really for all West Virginians day in and day out. Your recognition of our challenges is really very important to us and very meaningful to really all hospitals across the state. I also just want to thank you for all you've done over the past 20 months. We've been dealing with COVID across our state now for approximately 20 months. And, we've had a lot of success. We're still fighting the good fight, and we will get through this with your leadership and, frankly, the team that you pulled together. Dr. Marsh is outstanding. General Hoyer is wonderful to work with and always responsive and always available. Secretary Crouch, our relationship with DHHR at CAMC, and I believe it's the case across the state, has just really grown and blossomed under his leadership. And then Dr. Amjad and her leadership as well from the public health perspective. There's nothing easy about what we're all trying to accomplish on the public health front and to make our state a safer place for all of our citizens. It's great to work with them, and we look forward to continuing to work with them going forward. They're always ready to help, and we appreciate the fact that you pulled together a team of individuals that have that attitude. They reflect the attitude that you put forward as our leader. And so from CAMC, thank you very much for what you're doing for us today.
Thank you, Dave. I switched computers, so I hope everyone can hear me now. And finally, we have Dr. Kevin Yingling, who's president and CEO of Mountain State. We appreciate what Mountain... I apologize. So, Dr. Yingling?
Thank you, Secretary Crouch. Good morning, Governor Justice, to General Hoyer, to clinical colleagues like Dr. Marsh, Dr. Amjad. It's a privilege to be here this morning. I have 3 points I'd like to make today. Governor, you've caught me on a practice day. Just before I was here and just after I'm going to be here with you, I'm going to be seeing patients. The first thing I want to thank you for is your leadership, your effective leadership in bringing vaccination opportunities to every citizen in West Virginia. There's no doubt about that, whether it be the supply chain, whether it be the large vaccination sites earlier this year. For example, it's now sourced to our office, to my office. Today, I will be administering, or we will be administering third booster doses to patients, and we have primary booster doses that we'll administer today in our office. It's effective, it's appropriate. Thank you for your leadership. It's been very instrumental. The second thing I want to emphasize is an appreciation to Secretary Crouch, to General Hoyer, and to you, Governor Justice. As an example, we are administering antibody infusions on a regular basis. The supply chain for that has been a little frustrated, but through the work of your leadership and those that I just mentioned, we are administering that on a daily basis. As an example, I was contacted this morning on my way in of a family of 5. All 5 members of that family are COVID positive. 3 of them are sick. And today or tomorrow, the adults in that family and a child over the age of 12 will be able to receive antibody infusion. You all really make a difference, and I just want to be able to share that with you. And the third point I'd like to make is that your efforts in identifying the crisis within the hospital systems is absolutely essential. I realize today that there's actually some similarity, if you'll accept that, between being a governor and being a physician. And that is, when I walk out of here, I'm going to have to make diagnoses and I'm going to have to prescribe treatments. A governor is expected to make diagnoses and prescribe treatments. And I want to commend you on the fact that you identified that the Save the Care model was necessary. That's your diagnosis. And the therapy for that is to address the crises within our hospitals, to address the issues that my colleagues, Dr. Wright and Mr. Ramsey, have expressed. The remedy to that is to bring support to the hospital systems that have been so engaged in treating West Virginians. I mean, every single day in hospitals like Ruby, Charles Area Medical Center, and those here in Huntington, there's an incident command center that's necessary to address all the staffing challenges, all the unit needs, and in essence, bringing quality and safe care to West Virginians. It's been an enormous effort. It has costs. It has human costs. It has financial costs. We appreciate the fact that you made the diagnosis, save our care. We appreciate Secretary Crouch's efforts to bring us the proper therapy. And I appreciate the opportunity to express my and Mountain Health's appreciation to you for all your efforts. Thank you.
Thank you, Dr. Yingling, and thank all of you. We will be pushing the first phase of funds out within the next few days. So we hope to monitor things closely. We're looking to get information in terms of September staffing, and we will be working with you very closely. So we thank you all for your efforts and what you do every day. Thank you. Thank you, Jordan.
Well, first and foremost, I naturally appreciate the kind words. You know, I really and truly am humbled to just think about all the work that's gone in and all the stuff that these great people have done. I mean, at the end of the day, sure, we're making the right moves as far as coming up with a way to assist and help in any and every way we can, and put a big priority on protecting our people and saving our hospitals. And so saving our care, yeah, that's great. It's great stuff. But with all of that, you know, what we should all do is just step back and just think about all the folks that have really gone right into the fire every single day to protect and look after each and every one of us. You know, the hard work of all this, the health community in general, at this time, with no playbook and all the stuff that they've done, it is a real honor. I don't know how to say it any better. It's been a real honor flying with you, and really at the end of the day, we're going to get through this. But these great people have done so much good. Take time to try to show your appreciation, because they have really, really, really run exactly right into the fire. With all that being said, again, I thank you from the bottom of my heart. Your words are very kind, but at the end of the day, your efforts of what you've done. My dad always said, don't confuse effort with accomplishment. But your efforts have accomplished, and they have accomplished so much, it's unbelievable. Protecting our people, absolutely the number one priority. And I hope and pray that we've done that, and we've done that to the very best of all of our abilities, and that's what we're going to continue to do. And the only other thing I would say is just this, is if there's ever heroes in the world, it's these people. These people are true heroes. And so we should always, always remember that going forward. It's been a real honor. Now, you know, I've got one other thing is, you know, on just a little bit of a humorous note, I'm really glad that Secretary Crouch is able to operate this technology as well as he did. And I've never quite seen a person come on and say, okay, we've got this thing exactly right now. And then before he says 9 words, it starts going, woo, woo. You know, I thought he was beaming in, to tell you the truth. But nevertheless, you know, thanks, Secretary Crouch. You know, it's always good, I think, to smile a little bit. But the one thing I'd say is this. I was reading an article coming down here. I think I've got this right. I may have it wrong, to where across the country there had been 120,000 caregivers that were primary caregivers for kids that died in this terrible pandemic. And with that, what's happened, a lot of these kids have really drifted into foster care or whatever it may be. It's tragic in so many different areas. We need our prayers everywhere, everywhere. Now, again, and this one will be terribly humorous, but I've got with us today our curator of the arts in West Virginia, and this man does a phenomenal job. It's Randall Reed Smith, and you know, and Randall, from all of our hearts, and I mean it. He's stuck on all the time, and he does an incredible job. But today we're here to celebrate the National Yearbook Week. In 1987, President Reagan declared the week of October 4th the National Yearbook Week. In his proclamation, and I'm going to read this to you, school yearbooks not only chronicle educational achievement and school tradition, but are a part of them. For nearly 2 centuries, American students have produced yearbooks to commemorate the accomplishments of the school year and to compose a lasting record, written and pictorial, of campus, classmates, teachers, and school staff. In latter years, alumni treasured their yearbooks for memories that they hold of the times with their friends that have been times long gone by. So today I am celebrating the National Yearbook, but I'm doing it with a lot of hesitancy because Randall Reed Smith is going to show you pictures of Kathy and I from way back, and I'm doing it with great hesitancy, but I've gone along with this plan. So Randall, it's all yours now.
Hi, Governor. Thank you for having me today. And I wish I would have brought my yearbook because Kevin Yingling was my graduating classmate at Barbersville High School, and we're very proud of Kevin back home in Barbersville. Governor, back in December of 2004, there was a wonderful West Virginian named Clay Hamilton, and he donated 2,083 yearbooks to the West Virginia State Archives. And what we did when I came along, we decided to dedicate that collection, and we call it the Woodrow Clay Hamilton Jr. West Virginia High School and College Yearbook Collection. And in his speech when he decided to do this, he's quoted that it's a one-of-a-kind photographs of our ancestors and a glimpse of the time in which they were living. And Governor, they told me at the archives to tell you we have 2 gentlemen that come in about every week, and they research these yearbooks just to follow sports teams of the past and to document our sports history. We have people come in, look at our communities, our school history. All 3 of my schools are gone. The buildings are gone, and we just had a high school class reunion, and we all brought our yearbooks, and we were laughing at the hairstyles, which we're going to show yours here in a second, and the fashion. So also today we're sending out an email to all superintendents to help us continue to gather more. We have almost 4,000 yearbooks in the collection. It's probably one of our most researched collections. So Jordan, do we have pictures to put up? I'm going to show pictures. Or Jordan's going to put some pictures. There you go, Governor.
Oh, me. Okay, now we don't need to keep going on with this forever.
Oh, Governor, you want to talk about that golf swing there? Look at that, how perfect.
The guy on the left at one time, like I said, was skinny, and he had a pretty good golf swing, to tell you the truth, long ago.
So, Governor, we brought your yearbook with us today so you could autograph it for the collection. And I brought you a Sharpie that's very thin pointed. There's your senior yearbook, and here you go.
Where am I going to sign this?
Either with your name or there, wherever you want to sign it, Governor.
Okay. All right, you got it.
Thank you, Governor.
Okay.
We have
Thank
one
you.
more thing to talk about, Governor.
Oh, gosh.
Last year, I think you remember very well when we started the fall season, we didn't know if we were going to have schools, didn't know if we were going to have football, and we did have football, and I remember you saying, Randall, if we're going to have football, we're going to have marching band. Mm-hmm. And we did get to have marching band because of Dr. Marsh and Bernie Dolan and your insistence. We made it happen. We were the only state that had a live marching band competition. So coming out of this past school year, the bands were not allowed to raise any type of funds, and we decided, with your help and with the Department of Education, we actually have a Governor's Cup series. We've completed 6 competitions so far, and we have 5 more to go. In 2 weeks, we have the state competition. Here at Charleston, we have 42 of our 100 high school bands coming to participate. And at the end of the month, we go to Philip Barber that you can give away this beautiful crystal Governor's Cup. And everybody, I cannot tell you, we've been to Spring Valley, Huntington, Cabell Midland, Hurricane, Wyoming East, the first ever marching band competition in that county. They had probably 400 people there. They had, that's not including bands, we had 15 bands. Then we went to Woodrow Wilson. This week we're at both Parkersburg schools, then we're going to Musselman, and everybody is just saying, thank you, Governor. These kids need this. They need to have something that's normal in their life. Last year when we did the one competition, every kid in a Parkersburg High School band wrote us a letter and thanked us. And the drum major said we didn't know what we were going to have for normal for the class of 2021. But thank you for giving these kids normal. And Governor, we're excited because this year our reigning Miss Majorette will give up her crown, and that is Miss Baby Dog.
Oh, gosh. Oh, my goodness. Okay, Randall, you've had enough now.
Okay, thank you. Hey, Governor, you said earlier about keep telling our story. And at the archives, we create the storytellers and we keep telling the story. Thank you for everything you do for the arts. Everywhere I go every day, somebody says to tell you thank you. We appreciate you so much.
Well, Randall, we really appreciate you. You've done incredible work, and I love your enthusiasm. I love your fire, and you're right about the kids. You're right about these kids that are participating in band and everything. They need some level of normalcy and everything in their lives and everything. I couldn't be happier and everything, and I'm going to come. I'm going to come to Philip Barber when and I've promised that I'll be there and everything. And what a wonderful school.
It's great. And Field's beautiful.
And so no, I'll be there, and really, really proud of all you're doing and all the great work with our schools and on and on and on. Now, I'm not so terribly proud about these pictures, but nevertheless, I'll keep going with it. Okay, let's go back. Tomorrow I'll be calling a special session of the West Virginia Legislature. This is on all the redistricting that we have to do. We got to do this and everything, and it'll be set for next Monday, October the 11th, and the special session is a part of the legislature's constitutional duty to redistrict the state of West Virginia, and the call will also request that the legislature appropriate federal monies that have been received by the state agencies. And this will go out tomorrow. Just another announcement. There's a program called the Rental Assistance Program, and we had a real big influx of registration for this, but I want to go over this slowly and everything. And I hope, that people, the media will pick up and help me with it. And I hope that people across our state will be, dialing in and listening to this. But as of January, I announced the creation of the Mountaineer Rental Assistance Program, administered by the West Virginia Housing Development Fund. This program is helping renters and landlords that have been impacted by COVID-19. The program provides direct financial assistance to renters who have lost their job, had their income reduced, or suffered significant cost or financial hardship because of COVID. Today, I want to remind West Virginians that this program is still there. It's still there. If you are a renter, and you are struggling to pay your rent or utilities because of financial hardship because of COVID, you're eligible. You've just got to get in touch with us and register. Now here's the other part. Also, and pay close attention, this is just not for the renters. It's also for the landlords. If you're a landlord and your tenants are struggling with their rent or the utility payments due to COVID, you may be eligible for rental assistance as well. To date, now this is the end of this, and please pay attention to this. We have had 9,739 applications that have been completed and for requested assistance, which total $46.9 million. It's great. It's $46.9 million. But listen, people, listen. We have $200 million that have been appropriated for this program. If you're having trouble We need to hear from you. We can really help you. Okay, we've got a Health and Human Services report, and it shows basically just this, that, and I'm not going to go through the whole thing, but by moving and doing what we did, we absolutely saved massive amounts of hospitalizations and a bunch of lives. On the vaccine distribution update numbers, I'm not going to go through the whole thing. We're now at 65.4% of all of our people 12 and above. We've got 80.9% of the 50 and above, and 91.2% of the 65 and above who've got one shot. In our Do It for Baby Dog Round 2, we're going to give away a brand spanking new Corvette, and we're going to do it at the Charleston Auto Show that's right out here on the boulevard tomorrow night. We're going to be here, and Baby Dog's even going to come, and we'll ride around and say hi to a bunch of people. And then we're going to give away this, and in urging in every way, for people to be vaccinated. I guess we'll be set up here to be administering, first doses and second doses. Is that right, Jordan? And even booster shots. So the clinics will take place from 10 a.m. to 4 p.m. today and tomorrow, right on the boulevard out here. And so I appreciate, again, everybody working together, and I encourage everyone, at this show and everything to stay safe, and I hope we'll have a really good time there, and again, through encouraging in every way, in every outlet we possibly can, we want to encourage in every way to be vaccinated. However, we absolutely want to stand firm over the fact and be respectful of those that say, no, I'm not going to do that. That's their right. That's the foundation of our entire country. That's their right. Be respectful. Be great neighbors. Stay together. Love one another. That's what it's really all about. Vaccine eligibility, 12 and older. We need our parents and grandparents to help us get these kids vaccinated. It's going to get colder. There's going to be more situations in school. We've got to get our school kids vaccinated. We got 19,000 kids with our grand families. We need them vaccinated. Take advantage of the vouchers, $150. All the COVID-19, vaccine info's up on the hotline and everything. Absolutely, the testing is free. We thank Brooks, we thank Walgreens, and I remind you, get your flu vaccine. I got mine the day before yesterday. And so, or maybe it was yesterday, I don't know. But I just got mine, and so get your flu vaccine.
All right, thank you, Governor. Our full panel of experts is joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. My question's for Secretary Crouch. I basically wanted to ask the same question I asked at the beginning of the week. Now that we've got these Save Our Cares payments going out, is the $25 to $30 million overall price tag that you said on Monday, does that remain accurate? And then also, what is the window for the Save Our Cares program? We said we thought we'd have to have it in place from 3 to 6 weeks. Do we have an idea of how long we need to keep the program in place? Thank you.
Secretary Crouch, please. No, please.
Yes. Hey, Charles. Thank you, Charles. We're pushing out about $17 million here in the next few days. We have Monday's a holiday, but we hope to have that out Tuesday or before. That is kind of the first phase. That's looking at August personnel costs. It's additional costs based upon staffing costs from staffing agencies, overtime, and as I mentioned, some retention costs that folks are trying to develop to keep people on board on staff of the hospital. So that's kind of the first phase of this. It took a while to get the August numbers in. This is a difficult time for hospitals. They're very busy, so it took a little while to get all of those numbers in. We didn't get those all in until yesterday, so we hope we get September's in sooner, and then we plan on pushing out a little bit more. in terms of the total, we're probably looking at more along the lines of $35 million at this point. We're using a variety of funds, trying to maximize federal dollars so that we can save our state dollars as much as possible as they're needed. So we're really looking at a little bit more than I said on Monday, and we're looking at a timeline of probably once we get the data for September, pushing something out again in another couple of weeks for hospitals. Again, they've been very patient, and the governor's pushed hard to get this done. It's a little more complicated than folks realize in terms of the state match. We also have to be very careful, and the hospitals have to be very careful not to, and I'll use the term double dip. If the federal government provides funds to hospitals, which they have, and those funds need to be earmarked for a certain purpose, our funding needs to be earmarked for a certain purpose. If we end up, if we end up making mistakes in terms of documentation on this, then we could, through an audit, be required to pull money back. So we're being very careful. The hospitals are being great partners with us, and we appreciate all they're doing with this.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, I'm listening to the listing of the West Virginians who died since your last briefing. 9 of the 96, I think, was the total number, were 49 years old or younger. Does that tell us anything about the Delta variant attacking younger people more seriously than the first wave and then the Alpha variant? Or is the suspicion there are comorbidities involved with those younger deaths that really have nothing to do with their age? Thank you.
Okay, Dr. Marsh, it's you.
Well, thank you, Governor, and thank you, Kenny. So, of course, we know that the Delta variant, which is the variant that started in India, exists in up to or exceeding 1,000 times higher concentration in the airways and the nasal carriage area, and is aerosolized into droplets with much, much more virus. So we know this form of COVID-19 is much more infectious to a wide, variety of people who, during the initial part of the pandemic, when the original virus came from China, were really fairly much protected, including children, young adults. And we know, Kenny, that the rate of increase in the younger age groups has been fairly dramatic during the Delta spread in West Virginia as well as everywhere else in the world. So we are perceiving the fact that we are seeing some younger people die as a reflection of the much higher infectability and the bigger inoculum load that we are seeing with the Delta variant. But likely, the people that die do also have certain comorbidities that make them more susceptible to severe disease. The most important, other than age, is being overweight or obese. And that seems to be something that is really seen across the world. So we are carefully watching, our citizens, and that's why we really are so focused on recommending first and second vaccines for people that haven't had them, because these vaccines are very, very protective against the severe consequences of COVID-19. But also for people that are eligible, please get your boosters, because we know with the Pfizer vaccine, at least, the potency drops off pretty substantially after 6 months. Really good question. Likely the virus plus some comorbidities.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. I think I want to go to Dr. Marsh again on the booster shots. If you have had COVID and you have been vaccinated, should you get the booster, or has the vaccination actually acted as the booster for you?
Dr. Marsh, please.
Thank you, Governor, and thank you, Paul. So we do know from data, largely from Israel, that the combination of having recovered from infection plus vaccination gives you more immunity. Now, the challenge is that we, on a person-to-person basis, don't know yet, how protected each person is, which is why we started with our nursing home population and did our assessment with the antibody study. We would be very much, Paul, recommending that people be very careful because of the real severity of illness we're seeing with the Delta variant. And if you have had your Pfizer vaccine greater than 6 months ago and you qualify, then we would very much recommend that you get a booster vaccine, and that would be whether or not that you have had had native COVID or not.
All right, thank you, Paul. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, everyone. I want to follow up on the hospital issue too, and also get any update if we can on the supplies of monoclonal antibodies and whether they're increasing. I know our congressional delegation asked for them, but with regard to the hospitals, you had representatives from the three of the largest hospital chains in the state, yet we've had a tremendous problem with rural hospitals shutting down and closing or curtailing a lot of their care. What kind of money is available for the rural hospitals, the small independent operators, compared to the big chains?
Secretary Kraus, please. Secretary, you're muted. Come on, Bill, baby, get this right.
Sorry, Governor. I'm using Clay's computer. I apologize. Thanks for the question. Many of the critical access hospitals that you're referring to, those hospitals 25 beds or less in our rural communities, have also had staffing problems, and they're included in this in the governor's program here to Save Our Care. So we have critical access hospitals receiving funds just as we do the largest facilities in the state. So we had the three CEOs on from the largest systems. At some point, we'll have some folks on from the smaller systems as well. They're doing a great job out there in terms of monoclonal antibody treatment and taking care of folks in rural communities. So we don't want to leave those out. So Charles, I'm sorry, it wasn't Charles. It was, who? Mark. Okay. So thank you for bringing that up. Those folks are terrific and doing a great job in their communities.
All right, thank you, Mark. Next, we'll go to Evan Bevins with Ogden Newspapers.
Thank you. I wanted to ask, we talked a lot recently about the surging cases. I was wondering if Dr. Marsh or anybody else could address, kind of the mechanics of the decline we've seen. What were the circumstances that have led to this, steep decline in active cases? Thank you.
Dr. Amjad, talk to us.
Yes, Governor. So I apologize if the connection's bad. So we've seen a slight decrease in cases. I wouldn't say it's a complete sharp decline because, we're still seeing an after effect of that with people in the hospitals. But, we're going from an active caseload of maybe, 1,600 a day, 1,700 a day is dipping below 900. But I think what's happening with the Delta variant, as we've shown some graphs and we've seen graphs across the country, there's a huge peak and it dips down. I think the variant has kind of ran its course, but we're still seeing some cases out there. So we don't want people to think that just because we're seeing a less number that they need to let their guard down. They still need to get vaccinated. They still need to do all the mitigation efforts we discussed, because there is a time lag between the case numbers we see and the numbers in the hospitals of people getting sick. Thanks.
All right, thank you, Evan. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, panel. Thank you so much for taking my call. So my first question, just to follow up on Mark and Charles. Secretary Crouch said there's about to be $7 million distributed to these hospitals. Could we get a sense of the number of hospitals that is, or the percentage of hospitals total in the state that would get that money? And also, could we get a follow-up on the booster shots in nursing homes? I know that was supposed to wrap this week. Has it wrapped, and how many people got the shot?
Governor?
Yes, sir.
Yes, June. about 40 of the hospitals in the state, 39 or 40 of the hospitals in the state are receiving funding through this effort. Again, it's based upon the staffing cost of hospitals. Some of the hospitals, many hospitals have received funding through the federal government. They are eligible now for phase 3 of relief funds through the federal government. So those funds are covering other parts of hospitals' lost revenues. So that's why we chose the staffing costs. The governor pushed us to make sure we helped hospitals with staffing costs. Many hospitals, some of our rural hospitals, did not need that additional support out there. So that's why the number is lower than the number of hospitals in the state. We have about 21 critical access hospitals, and many of those have gotten funds as well, but not all. So thank you, June.
All right, thank you, June. Governor, I'll turn it back to you.
Well, we've been through lots of stuff here today, and you know, I tell you that we've been through announcement after announcement. We've talked about how well West Virginia's doing, being in the top 10 in the nation in GDP growth. We've talked about lots of different things, from, you know, our National Guard and all of our health community being ready to give boosters. We've talked about an appointment of a great man to the Senate, you know, our first, you know, African-American, you know, gentleman ever in the Senate, and the first African-American being in the Senate in the last 20 years, long overdue. We talked a bunch about, you know, the stuff about us trying to work with and help our hospitals. God forbid, we've even talked about yearbook stuff, and I wish we could have selected somebody else in regard to that. We talked about the rental assistance program, and it just goes on and on. You know, we probably got a little animated with Amy Goodwin, and Amy is, you know, to be perfectly honest, I think she ought to pay a whole lot of attention to her city and not be so preoccupied with throwing out some political statement. From the standpoint of the city of Charleston, if you just step back and think just about this in every way, there's issues in the city of Charleston. They got $60 million. They ought to be trying to do things to fix those issues instead of trying to divert attention away, and attention away in any way that it could possibly be. From the standpoint of you know, just take this one situation, you know, from the overall crime in West Virginia, since the day I walked in the door, it's less and less and less statewide, except in Charleston. You know, and I know there's probably other places, but in Charleston we can do a lot better. We can do a lot better. We don't need to absolutely just hang our hats on, you know, a word here and there. We need to hear the message. And the message is real simple. It's just as simple as mud. We absolutely have got to do better in our own house. Charleston, West Virginia. Let me just say just this. You know, when I came in the door, and a lot of people cast a few stones about this, I said our Capitol grounds need to look spectacular. And so we spent a little bit of money, not much, but a little bit of money, to make them absolutely as beautiful as we could do. Not going overboard by any stretch of the imagination. Maybe just instead of having 3 or 4 extra parties at the mansion and passing out liquor everywhere under the sun, we decided not to do that. We planted a few extra flowers, didn't we? And our grounds are absolutely just unbelievable. And they've been that way and been that way. Visitors from all over the world come and see how great we are right here in West Virginia. And God knows the pressure is unbelievable, and people that work in these offices and everything, you know, that are sometimes being badgered in lots of different ways that maybe they shouldn't be, from the media or whatever it may be. You know, their walk across the street to get a cup of coffee or to get lunch or whatever, and walking through and seeing that beauty out there is surely heartwarming. In all of that, We need absolutely to do all we can possibly do. This is our state capital. This is our house. And we need to do all we possibly can do to make things better and better right here. So in all of that, I would tell you, just see and hear the message. We've got a lot of good things going on, but the underlying thing of all is just one thing. Nothing compares to, we lost 97 people. 97 people. I read through every one, and trust me, I don't read that because it's, grandstanding or heartwarming or whatever. It is heartwarming, but it's tough because I hate it. I hate it really, really bad. I hate the fact that we've lost this wisdom, these good people. The other day we lost a 20-year-old, but it's tough stuff, especially when you know there is only one way out of this. There's only one way, and that's absolutely to get vaccinated. So I encourage you every day, and I'm going to keep on doing the same thing. Thank you so much. Appreciate you.
Family doctors, nurses, and pediatricians recommend West Virginians 12 and older get a COVID-19 vaccine because it's the best protection from COVID. Protect yourself and others. Talk to your doctor or trusted healthcare provider about getting vaccinated.